Hello students. In this video, I'll be talking about Menieres disease. Whenever I start with Menieres disease, I just remember one thing. First of all, remember this thing. M with Menieres disease, M stands for males and M stands for medical management. Fine. Menieres disease is much more common in males, and medical management is the mainstay management for Menieres disease. Fine. It is totally different from autosclerosis, where in females it is more common that autosclerosis, and surgical management is the mainstay treatment for autosclerosis. But if you are talking about Menieres, M for medical management, and M for males. It's generally a unilateral disease. Remember that it's generally a unilateral disease. Fine. Actually, what happens is there is something called as endolymphatic sac. So that endolymphatic sac gets filled with excess amount of endolymph. That's why we call it as endolymphatic hydrops. So as the endolymphatic sac gets filled with excess amount of endolymph, as it gets filled with excess amount of fluid, so what will happen? It will lead to basically three symptoms, that is tinnitus, vertigo, and sensory neural hearing loss. Fine. And the deafness that is particularly seen in these kinds of individuals having Meniere's disease is fluctuating hearing loss, or fluctuating sort of decreased hearing, or fluctuating deafness. So remember that fluctuating thing. It is characterized by tinnitus, vertigo, and sensory neural hearing loss. Fine. If we talk about the Renes test, obviously Renes will be positive. Reason being, Renes is positive in normal and sensory neural hearing loss. Weber will be lateralized towards the normal ear. The investigation of choice is electrocochleography. Remember that electrocochleography is the investigation of choice, where if it is less than 0.3 it is normal, if it is greater than 0.45 it gives the diagnosis of Meniere's disease. Now there is something called as Lermoyer's syndrome. What happens in Lermoyer's syndrome if that TVS is not appearing? Fine. In Meniere's it is in the arrangement of tinnitus, vertigo, and then sensory neural hearing loss. But supposedly it is sensory neural hearing loss first, then vertigo, and then tinnitus. Then it is called as Lermoyer's syndrome, or it is called as the reverse Meniere's. Then there is something called as Tullio's phenomena. Tullio means vertigo. More vertigo in loud sound is called as Tullio's phenomena. If there is more vertigo in case of loud sound, it is Tullio's phenomena. If the patient is having history of drop attacks, it is called as the Tumarkin's crisis. Now, there is something called as diaplacusis villi. What is diaplacusis villi? It is the perception of two different sounds whenever we are giving just one single sound. Supposedly, we are giving one single frequency of sound or one particular sound. Then also the patient will feel that I am hearing two different sounds. And there is something called as recruitment phenomena. What is recruitment phenomena? Even a single decibel of change is felt as a very big change by the patient. Supposedly, if I am increasing my sound intensity from 20 decibel to just 21 decibel, just 1 decibel increase, patient will feel that I am hearing sound of 35 decibel. That much significant increase the patient feels, even we are only changing just 1 decibel of sound. Fine. Lastly, you have to remember that medical management is the mainstay management. In medical management, we just give basically a diuretics. More the fluid will come out from the body, the patient will feel better. We give a low salt diet. There are something called as Meniere's device, low pressure intratympanic therapy. Very rarely we do endolymphatic sac decompression sort of surgeries. Very rarely we do endolymphatic sac decompression sort of surgeries. And at last, if the patient is not healing medically, not healing surgically, we can go with intratympanic gentamicin. We just give gentamicin because it is an ototoxic drug, so it acts sort of in the labyrinth part, destroys the labyrinth part completely, which is called as chemical labyrinthectomy. Fine. So this is the mainstay treatment. For vertigo, we can give some vestibular suppressants. Fine. There is something called as glycerol test, which at last I'll be discussing. What is glycerol test? In glycerol test, we just give glycerol orally. It acts as a dehydrating agent. It reduces the endoluminal pressure and it improves hearing immediately. So by just glycerol test, we can check for the Menieres disease. Fine. These things are the facts that you have to remember for Menieres disease.